I'm James Larner, Chair of Radiation Oncology at the University of Virginia. We are a small department, but nonetheless we're part of NCI-designated cancer center, and we're part of a top-tier medical school. We have 4, hopefully soon 5 R01s within our department. We realize our primary mission is to train residents to be superb clinicians.
Hello, my name is Einsley Janowski, and I'm the Residency Program Director here at University of Virginia. I think the best part of our residency program are our residents. They're caring, capable, and compassionate. They're intellectually curious and clinically excellent. It is a pleasure to work with them and an honor to train them.
Hi, I'm Jason Sanders, and I'm one of the chief residents at the University of Virginia Department of Radiation Oncology. During my interview, the first thing that really struck me was that everyone I met with seemed genuinely interested about me as not just a medical student, but as an actual person. They asked me about my interest in research and radiation oncology and then things outside of the clinic.
My name is Christina Ward. I'm currently a PGY3 here at UVA. As a medical student, I was lucky enough to rotate here, and what really stood out about UVA amongst the other programs were the people. When I was here visiting, I could tell that the residents were family, and that has really come true now that I am a resident here. We have a really strong clinical education program here. We see a wide variety of cases. We have a robust clinic schedule, and a very strong brachytherapy program, which was another one of the reasons I decided to choose UVA.
Hi, I'm Carla Romano. I'm an assistant professor here in the Department of Radiation Oncology at the University of Virginia. At UVA, we're really lucky to have an excellent brachytherapy training program and an excellent brachytherapy clinical program for our patients, which means that we see a wide range of early stage to very advanced stage disease that we treat for both gynecologic cancers and prostate cancer.
When I took over as Residency Program Director, in order to improve the residency experience, I really wanted to focus on the things that I was insecure about and anxious about when I was a resident. And one of those things was how to understand the physics curriculum. Physics is a part of the boarding process. So what I did, as well as enlisting the help of Dr. Romano and some of our excellent clinical physicists, is to develop a boot camp curriculum for our residents. This gives them clinical vignettes and how we incorporate physics in the safety and precision of our radiation treatments. It's a week-long program, and we've gotten excellent reviews from our residents.
My name's Tim Showalter. I'm professor in the Department of Radiation Oncology, where I specialize in genitourinary cancers and brachytherapy. I'm involved in helping residents grow their research skills across a variety of research methodologies, ranging from simple chart review studies to more complicated outcomes research. I also enjoy mentoring residents in development and conduct of clinical trials.
My name is Chris Lumina. I'm currently a PGY4 resident here. I chose to come to UVA after doing a visiting rotation here. During that rotation, I really felt like I fit in with the residency culture. Our co-residents are really supportive and kind and friendly to work with. I think the culture of having really approachable, friendly attendings translates into research opportunities that go really well. I think a lot of people feel like resident research needs to be, small retrospective studies, but I've had a chance to work really closely with Dr. Showalter in brachytherapy and worked on what was first a retrospective dosimetric study of MRI prostate brachytherapy guidance, and then transitioned that into a prospective trial that I got to write and then open at UVA.
My name is Don Mueller. I'm a chief resident at the University of Virginia. So I've had a lot of very great experiences at UVA, one of which was I was able to study abroad in Zurich, Switzerland. They have a proton center there called PSI. It was a great experience. I got to learn not only how protons are used, we got a good experience in pediatric malignancies, but notably how the Europeans do things. It's a little bit different than the way that it's done in America. I was rather undecided. I really liked going into private practice. That was something that I had thought about doing because that's what I had my first experience in. However, I've had a lot of good opportunities to participate in research, so academics was something I was also interested in. I couldn't have had more support. Attendings really went to bat for me, and I was able to find that perfect mix of academics and private practice in the city that I grew up in.
So Charlottesville's a great town. It has a small town feel with the large amenities that you would get in any city. I grew up in Houston, Texas, and moving to an area of the country that has mountains and seasons and beautiful trees is a very nice change, and I would highly recommend it.
Radiation oncology is obviously a technically oriented subspecialty. Our portfolio of equipment is extraordinary. We have a long history of having a gamma knife. We have a total of 4 linear accelerators. We're expecting a MRI LINAC to be on board within the next 12 months. I'm extremely optimistic about the role UVA radiation oncology is going to play in the future of our specialty. As a board-certified medical oncologist in my previous life, I strongly believe that the best drug we have is radiation. It's not only the most efficacious, it's the most targeted. I hope you will give UVA radiation oncology serious consideration. I would like nothing more than for you to join our team so that together we can advance the field.